Hello, my name is Wes Hayden, President and co-founder of CoachCare. In this video, we will talk about which providers can bill for remote patient monitoring and what to do if you are not a provider who can bill RPM. So first, let's look at how Medicare defines this, as they're perhaps the biggest advocate and payer for RPM. Now, the Medicare Claims Processing Manual dictates billing procedures for Medicare-covered services, including RPM. And RPM falls under Evaluation and Management Services, or E&M. So we have included a screenshot from the manual here, highlighting which providers can bill E&M services like RPM. Now, per the Medicare Claims Processing Manual, physicians and specific non-physician practitioners can bill E&M services like RPM. And these non-physician practitioners include nurse practitioners, clinical nurse specialists, certified nurse midwives, and physician assistants. And just so you're not confused, the CMS rules that introduced RPM used the term qualified healthcare professionals instead of non-physician practitioners. But these terms basically mean the same thing. They are senior clinicians that can bill these codes themselves. However, this list of providers is not comprehensive, and the manual notes that the full list will vary by state because each state has its own licensure rules. So now if we look at this on the state level, our RPM billing experts have actually pre-verified RPM qualifications across most states. And based on that experience, here is the list of provider types we see most commonly eligible to bill RPM in each state. And you can see this basically aligns with the Medicare definition. However, the best way to confirm this for your providers is to contact your state Department of Health to determine if RPM is in the scope of practice for each of your provider types. And we can also do this on your behalf if we work together. Now, a couple of points to keep in mind here. First is that clinical staff can deliver the RPM services under the general supervision of these providers. So these providers don't have to deliver the services, they just have to bill them. And secondly, the reimbursement rates for RPM will differ between these different types of providers. So physicians, that is MDs and DOs, will generally have the highest reimbursement rates. Now, if you or your team do not fit those provider criteria, you may be asking what you can do to bill RPM. Well, we have clients who are chiropractors, physical therapists, or mental health professionals who unfortunately cannot bill RPM on their own yet. And in that case, the best solution is to partner with a physician or another provider who can bill RPM for your patients, and then split the revenue with the billing provider. So you supply the patient volume, and the billing provider is able to bill them. And we've seen this model work well to drive a significant new revenue stream for practices, and also benefit patients with this new effective monitoring service. Also, you should know that we and others in the industry are actively lobbying CMS to permit additional types of providers to bill RPM. And here you can actually see a screenshot of the comments that we sent CMS on the 2021 fee schedule, where we advocated for additional providers to bill RPM. So while CMS did not change its provider rules, very often, and it didn't here, we will continue to advocate to expand access to RPM and other virtual services that are critical to the future of healthcare. So I hope this video has been helpful. And for those of you not familiar with us, over the past 7 years, CoachCare has worked with thousands of health systems, physician groups, and independent practices to support their virtual health and remote patient monitoring needs. To learn more, all you need to do is schedule a Q&A and tour of our technology. I'll answer all your questions about RPM, and together we'll calculate how much you can make by implementing RPM in your practice. There's a link to book a call alongside this video, and thank you for your time.